If your doctor taps your ankle and gets no response, that is not nothing. That is your body sending a serious warning signal. Over 30 million Americans over the age of 60 are living with undiagnosed lumbar nerve compression right now, and most of them think it's just bad knees or old age. But here's what the research shows. When the S1 nerve root is damaged and left unexamined, patients face a 47% higher risk of progressive muscle weakness, chronic falls, and irreversible spinal disability. Today, one of America's most respected orthopedic surgeons is going to show you exactly how to identify S1 nerve root damage before it steals your ability to walk. Dr. Nabil Ebraheim is a world-renowned orthopedic surgeon and anatomy educator with over 30 years of clinical experience. He has treated thousands of patients with complex spinal and nerve conditions, and his medical education channel has helped over 3 million people understand their own bodies. When Dr. Ebraheim explains a nerve examination, you are getting frontline, hospital-grade knowledge delivered clearly and directly. The S1 nerve root exits your spine at the very base, between the L5 and S1 vertebrae. It controls sensation along the outer edge of your foot and little toe, powers the muscles that allow you to push off the ground when you walk, and drives one of the most important reflexes your doctor tests, the Achilles or ankle reflex. Here's the danger. As we age, our spinal discs lose up to 40% of their hydration by age 65. That dehydration causes disc herniation and bone spurs that compress this exact nerve root. And when S1 is compressed, you do not just feel pain, you begin losing function, silently, until one day you cannot lift your heel off the ground. Mistake number one seniors make, they blame foot and leg pain on arthritis or poor circulation, and they wait. A landmark study published in the journal Spine found that patients who delayed S1 nerve evaluation by more than 6 months had a 38% lower rate of full motor recovery, even after surgery. Meet Margaret, a 67-year-old retired teacher from Ohio. For 2 years, she managed what her local doctor called sciatica. By the time an S1 nerve root compression was properly identified and examined, she had developed significant weakness in her calf and could no longer climb stairs unassisted. The examination findings were there all along. Nobody looked for them properly. So what does a proper S1 nerve root examination actually look like? 3 findings: sensory, motor, and reflex. Sensory, your physician should test light touch and pin sensation along the posterolateral calf, outer ankle, and lateral foot, the precise S1 dermatome. Numbness or reduced sensation here is a red flag. Motor, S1 controls plantar flexion, your ability to push your foot downward and rise onto your toes. A simple toe raise test comparing both sides reveals early motor weakness that patients rarely notice themselves. Studies show that a 20% asymmetry in strength between legs strongly suggests S1 involvement. Reflex, the Achilles tendon reflex tapped at the heel is the most diagnostic single test for S1. A diminished or absent reflex compared to the opposite side correlates with S1 root compression in over 85% of confirmed cases. These 3 tests performed together give your doctor a complete neurological picture of your S1 nerve root health and the power to intervene early. If this information could help someone you love, a spouse, a sibling, a friend over 60, please hit the like button right now and share this video. Subscribe to this channel because every single week we bring you the medical knowledge that your doctor may not have time to explain in a 15-minute appointment. And drop a comment below. Tell us your age and whether you or someone you know has ever experienced leg, foot, or heel pain that was dismissed as just aging. We read every comment. Your ability to walk, to climb stairs, to move freely through your life, that is not guaranteed, but it is protectable. Knowing what the S1 nerve root does and demanding a proper examination could be the difference between catching a correctable problem and living with permanent disability. You are not too old to advocate for your own neurological health. In fact, right now is exactly the time. Stay informed, stay mobile, and stay with us because your best years are not behind you. Subscribe, and we'll see you in the next